My name is Lucie Moravia. I work at Wellspan York Hospital in the Division of Maternal and Fetal Medicine, and today I'm here to talk to you about my experience. So again, the Queenan Fellowships for Global Health, there are 4 of them. They were launched in 2015, named after John Queenan, and awarded by the Pregnancy Foundation. I applied for the Visiting Teaching Fellowship in Obstetrics and Gynecology departments in Africa. So essentially applying for this fellowship wasn't a fluke. You know, I sat down, I looked at all the other options, and I felt like this one fit me the best. I have an extensive history. I know I look 26, but I'm not. I have an extensive history in research. I was an arboviral epidemiologist for the state of Georgia, as well as an employee at the Centers for Disease Control in Atlanta. And I wanted something that wasn't necessarily research-based, and I wanted to foster my career for the future, which is essentially, I want to be a visiting faculty in a foreign country. I chose Ghana because after I did a master's in public health at Emory University and stayed in Atlanta for a total of 8 years working in public health, I was afforded a scholarship to do research at Noguchi Memorial, which is located in Accra, Ghana. And I did research there, so I was familiar with the country. I also wanted an English-speaking country, and I wanted someplace that I was familiar with, and I knew that I would be taken good care of because my husband is a Ghanaian. So I was like, I'm good. And then after I received the call from Dr. Tim Johnson, and we had a lovely conversation, I wanted him to be my mentor, so more push to pick Ghana. So I had 2 objectives, and one objective was to lecture on topics in high-risk obstetrics. I met with faculty, the division head, as well as their chief resident to try to iron out which topics were of most importance to them and which topics they felt they needed the most lectures on. So all in all, I eventually wrote about 15 to 20 lectures, and these were like lectures on demand. Lectures on demand with Ghana internet. So needless to say, good thing I have insomnia because it took hours. But I also brought textbooks and things with me to help because I knew the internet situation. So again, the topics were driven by the chief residents. I also was given the task of developing the maternal fetal medicine fellowship curriculum for the first SMFM fellowship that will be launched in Ghana. So when Dr. Johnson, he's like, yeah, you know, you go, you deliver lectures, and then you'll do this MFM curriculum. So I was like, yeah, sure. And then he emailed me and was like, yeah, how about that curriculum? And I was like, he's serious. Oh my God. So I just took 2 to 3 good weeks to observe my surroundings, observe the education, observe what their need was, observe the way things would have to change in order to implement a fellowship. And this morning I spoke in more detail about that, but what came of it is that I presented to the Ghana College of Physicians and Surgeons and to the head of the West African College, as well as Dr. Johnson. I presented a thorough curriculum that included suggestions for block schedules, all the way down to didactic lectures, and a complete curriculum that I initially used the nuts and bolts of the ABOG and the Royal College curriculums. That curriculum we are projecting to hopefully get approved by July and hopefully have a plan rolled out to start training the current interested faculty to eventually accept the first fellow. So ultrasound is about 40 CDs in Ghana, which is about $10. The average salary in Ghana per day is about $2. So they would have to save a lot of money to even have an ultrasound. That's one of the reasons why most of them don't get an ultrasound until the late 3rd trimester. So I gave them pro bono ultrasound to allow for residents to scan them. So each set of residents there was a new patient. And I just went through simple stuff like placentation, amniotic fluid volume, presentation, and for the people who are a little bit more advanced, attempted biometry. What came out of all this? One, I learned a lot from Dr. Johnson. I learned how to navigate in another country with people of decision makers, people who hold positions that could either make or break the starting of the fellowship. Additionally, I was invited by Dr. Johnson to write a chapter on ethics and global health. I was also the author of the MFM curriculum that will hopefully make its way through revisions and survive. And I was, through that development, I was invited to join an SMFM committee, the African Coalition for Excellence in Obstetrics and Neonatal Care, the subcommittee that Dr. Tolosa spoke about earlier. So teaching an audience with a different background from you, or who don't have the materials and the resources that you have, when you're preparing that lecture for them, you just can't basically say, start your MTP, 641, or take them to the OR, or, it's not as simple. So when you lecture to these people, you have to tailor your lecture to fit their community, to fit their resources, to fit their need, and that takes a lot of research. Additionally, I formed relationships that will last a long time. I formed a bond with Dr. Johnson. I formed a bond with both faculty at each institution. I'm hoping that eventually I'll be invited to be a visiting faculty member. I'm currently working on teleconference communication with the team in Campo Noche. Right now, what they're doing, they WhatsApp me their pictures and their questions, but I want to have a team approach to helping them through teleconferencing. And I also secured the Thomas Garrity mini sabbatical to learn SIM with Dr. Shad Deering in Bethesda, Maryland, in which he is committed to not only teaching me SIM that is applicable to the United States, but he is committed to teaching me SIM that is applicable to resource-limited settings, in which I can then learn SIM, and take the SIM back to Ghana. So, workshops are useful, and writing reports are useful, and delivering lectures are useful, but if you don't forge a bond with people, then once you leave, it kind of stops right there. And I think that having residents reach back and say, I learned a lot, thank you so much, is there anything you could do to help me? And I was sending virtual texts, so e-texts, so I would keep the relationship going like that. And I do plan to return and continue our teleconferencing initiatives.